The privacy and security of patient health information is a top priority for patients and their families, healthcare providers and professionals, and the government. Federal laws require many of the key persons and organizations that handle health information to have policies and security safeguards in place to protect your health information. This is whether it is stored on paper or electronically. However, in the recent years, more private information is stored electronically and paper is becoming obsolete. Yes, James, do you have a question?
Yes, Miss Sama, I do. What information is protected by the privacy rule?
Good question. Privacy protections apply to your individually identifiable health information, which means information that relates to the individual's past, present, or future. This includes the physical or mental health or condition, to the provision of health care to an individual, or future payment for the provision of health care to the individual. Also, information that identifies the individual, or for which there is a reasonable basis to believe it can be used to identify the individual. Any more questions before I send you all into the workforce utterly confused? Mr. Bryan, since you're obviously on your phone trying to research some information, why don't you pose the next question for the classroom?
Sorry about that, but I do have a question. Who has to follow the HIPAA privacy rule regarding the use and sharing of my health information?
Ah, yes. Most doctors, nurses, pharmacies, hospitals, clinics, nursing homes, and many other healthcare providers are held accountable. In addition, there are health insurance companies, HMOs, most employer group health plans, certain government programs that pay for healthcare, such as Medicare and Medicaid. You didn't even hear me, did you? Put your phone down now.
Miss Emma,
What? I mean, yes, dear.
what are some of the ways that my health care information may be used and shared?
To make sure that your health information privacy is protected, the HIPAA privacy rule allows your information to be used and shared in the following ways: for your treatment and care coordination. For example, your doctors can see what tests you have had and their results, so tests do not have to be repeated, with doctors and hospitals that provide you care, to provide payment for their services, to make sure doctors and other healthcare professionals give good care, and also for protection of the public's health, such as to report when a flu is in your area. Your healthcare provider or health plan does not have to ask you whether they can use or share your health information for these purposes. Well, class, I suppose if that's all of the questions for today, then we can go.
Hold on, I have one more important question.
Of course you do. What is it, James?
Can I control who sees or uses my health information?
It's called a textbook, James. Try and read it sometimes. But in many circumstances you have the right to control who sees or uses your health information. Some examples are, in general, your health information cannot be given to your employer, used or shared for things like sales calls or advertising, or used or shared for many other purposes unless you give your permission by signing an authorization form. This authorization form must tell you who will get your information and what your information will be used for. This is a different form than the document that your provider may ask you to sign on your first visit that tells you how they may use and share your health information and how you can exercise your rights. Providers generally may not share private notes about mental health counseling sessions unless you give them permission to do so. You can ask your provider or health insurer not to share your health information with certain people, groups, or companies. For example, if you go to a clinic, you could ask the doctor not to share your medical record with other doctors or nurses in the clinic. However, the clinic does not always have to agree to do what you ask. In some cases, for instance, your doctor may need to share your information to ensure proper treatment and coordination. Okay, really, class, that's enough for today. I don't want to overwhelm you, especially around exam time. Said no teacher ever. Ha 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 ha. There will be a test next Tuesday.
As much as we like to look at the bright side of healthcare, where we treat people and heal them, we can't ignore the slip-ups on our part that cause greater trouble for patients. This is Mrs. Jones. Well, Miss Jones now. Her husband died in our facility not too long ago. The sad part is that his ailment isn't what killed him. It was our neglect. Deaths due to medical errors occur more often than you think. Around 98,000 deaths per year actually, all of which can be fixed by the proper EHR systems. EHR can help to improve the quality of care a patient can receive. so we can start to reduce that number of deaths due to medical errors.
EHR also helps to improve patient care for providers with easy access to patient records, decision support, complete documentation that facilitates accurate coding, and billing. EHR improves the ability to diagnose diseases, prevent medical errors along with improving patient outcomes. It allows the physicians to deliver patient care. It also helps improves communication and relationships between family physicians and their team members. Chart summaries and medical notes. Some positive impacts include patients being more satisfied with the quality of care and with the access to their health information, and also decreased healthcare costs.
Mariam, you forgot to cut the stove on again, and somehow managed to set the pancake mix on fire. Houseway.
Sometimes, accidents happen.
I don't know how she broke her leg making breakfast, Mother. But we're at the hospital now, let me call you back.
Thank you for trusting your local healthcare provider and visiting our emergency room. Please be seated over there and we'll be with you within the hour. Or something like that. Good day, Steve. How's the wife? I hear you're here for a checkup. What can I do for you?
My wife can't cook, so she broke her leg. We'll need some serious pain medicine.
All right, just give me a moment.
As previously stated, EHR systems help to benefit our clinicians as well as our patients. Let's say Dr. Bill has no idea what types of allergies Miss Mariam has. Dr. Bill is now beginning to write a prescription for her pain. He prescribes her 800 milligram ibuprofen, unknowing that she is allergic to its main ingredients. Not only was he unaware, but he didn't make very much of an effort to dig through her files either. See how quickly we can go from a situation where a doctor is just trying to help, to a situation like this. Sad, right? Such a simple mistake. Now let's redo this scenario with an involvement of an EHR system.
There doesn't seem to be any allergies in her previous prescription files. I'll prescribe her some ibuprofen. Wait. What's this? My God, I've almost made a terrible mistake. Here's an allergy listed right here. What was I thinking prescribing ibuprofen for a broken leg anyway? Thankfully, while prescribing your wife her pain medicine, I noticed that she does indeed have allergies. You may collect your prescription at the pharmacy on the way out. Mariam, this is the last time I ask you to make breakfast. You nearly killed both of us in there.
EHR has the ability to support other care-related activities directly or indirectly through various interfaces, including evidence-based decision support and quality management. I wonder what other scenarios would be a good time to use integrated EHR systems.
It's nearly impossible to properly treat a person without knowing a majority of their personal information. This is where HIPAA comes into play. For example, Jennifer and Tom met on a dating website called blackpeoplemeet.com or Backpage or something. They were perfect for each other. But one day they went to get tested and discovered Tom had the package. Now, you may be wondering, how does this tie into EHR systems and HIPAA? When a patient comes in with problems, particularly problems that may cause them embarrassment or ridiculed, it is our responsibility to keep such information confidential. Should someone leak such precious information, or should unauthorized staff see such information in the EHR system because of lack of clinical responsibility, it won't be good. EHR systems are still flawed in nature. There is not a 100% guarantee that they can keep all information accessible as well as discreet. In addition, staff must be trained to use it.
In the end, healthcare is more than flu shots and surgeries. People need us not only to keep up with their health but also with our technology that can help make things better. I still can't believe that something as simple as a mistake could cost someone their life. That's why I want you to take this seriously. We're not playing doctor anymore. Sooner or later we're going to escape from this classroom into the real world, and I want you to be prepared. We are the leaders of a new system of healthcare. Please take value in your craft and learn everything there is to know about EHR systems. Technology is advancing quite fast. WHO knows there might be new systems by our time. Thank you all for paying attention. I hope you learned something today as well as got a few laughs in. Goodbye, and may you all be great in your respective fields.